In this video, we're going to talk about how to diagnose a frozen shoulder, 3 common characteristics of most frozen shoulders, what exactly a frozen shoulder is, and who is most likely to have a frozen shoulder. Hey everyone, welcome to the front row. My name is Deboo, physical therapist out of Integrated Physical Therapy in Bellingham, Washington. Been a physical therapist for like 26 some years now, and whenever I see frozen shoulders, I always run them through a series of tests to see if it indeed is a frozen shoulder, because unfortunately you could have a tendonitis and a little tightness of the capsule, so you can have more than one thing at once. However, there are a few things that we can check to see that pretty much will determine whether or not it's a frozen shoulder. Frozen shoulder is also called an adhesive capsulitis, which is basically a fancy way of saying that there is scarring and adhesions of the joint capsule of the shoulder. Who's most likely to get a frozen shoulder? Women more than men, especially over the age of 55. If you're diabetic, if you've had a history of a previous frozen shoulder, it's more than likely that you're going to develop a frozen shoulder on the other side as well too. Or if you've had an injury of the shoulder and you've been immobilized or you're not using it and you kind of baby it, and one day you try to lift it up and you realize it just doesn't go any further, that shoulder is now frozen. The positive things about most frozen shoulders is that they are self-limiting, which means that even if you do nothing, they should get better. Maybe not perfectly better, but they should get better. That's the good news. The not so good news is that sometimes that time span can take anywhere from 2.5 to 3 years. However, you can reduce the amount of time it takes to regain function and reduce pain by doing the exercises. But first, let's talk about, do we really have a frozen shoulder? When a client comes into my office with shoulder pain, I'll do a series of some basic tests to try to figure out, kind of tease out maybe what's going on. Is it more of a tendonitis? Is it a bursitis? Is there possibly a fracture? Is there a dislocation? Some of the obvious ones, the dislocations, people are going to be in a significant amount of pain in cradling their arm. The big thing I'm trying to determine is whether or not it's a frozen shoulder versus a tendonitis or an impingement of the shoulder. The first thing that you'll find with a frozen shoulder is that the active range of motion and the passive range of motion tend to be equal. Let me explain that. I'm going to have them lift their arm up as far as they can, and usually they'll get to about here and they'll be like, okay, it's as far as I can go. Then what I'll do is I'll grab their arm, or you can grab it with the other arm, and I'll say, keep your arm limp, and I want to see as far as I can go. And if it's more of a tendonitis, which means an irritation or a tendinosis of the muscle, I should still have good passive range of motion, which means I can lift that arm up well beyond their limitation and bring it back down again as long as I'm cradling the arm. But with a frozen shoulder, because remember it's a capsular issue, the muscle is generally okay. There is muscle guarding, but the muscle is okay. It's the capsule that's become tight and adhered into that. So my passive range of motion and my active range of motion is going to be similar. And that's a key indicator for a frozen shoulder. The next thing I have people do is bend their elbows up, thumbs to the outside. And let's pretend this is my affected side, my right side. I'll say take your left one out as far as they can go, and we're just basically checking external rotation. And oftentimes on the affected side, they will have lost a significant amount of external rotation. If they've lost over half the motion, then that's also indicative of a frozen shoulder. The third characteristic is I will do some muscle testing. I'll do a bicep test, I'll do a tricep test, maybe even a deltoid within their range of motion, a deltoid test, and usually strength testing of the shoulder. The rotator cuff, bicep, tricep is usually pain-free. Why? Because remember, a frozen shoulder affects the capsule a little bit more than the muscle. So within this range of motion that they might have, they have pretty pain-free muscle contractions as long as it's not a real fresh frozen shoulder. Let's quickly recap those 3 signs. First sign, number 1, active range of motion and passive range of motion tend to be equal. Number 2, a significant loss of external rotation as compared to the opposite side. And number 3, muscle contractions are usually pain-free. So bicep, tricep, rotator cuff, deltoid are usually all fairly pain-free. So if you have all three of those signs, it's more than likely that you have a frozen shoulder. It's important to make that diagnosis because the treatment is a whole lot different than, say, if you had an impingement, which is more characteristic of, I'm fine, that hurts, but then when I get to the top, I'm fine, but the way down, ooh, I need to support it. In an impingement, I might be able to go all the way up and down passively without any pain, but frozen shoulder, you are not doing that. At the end of this video, I'll put a link to a series of shoulder exercises that will really take that 2.5, 3-year mark and really condense it down, maybe 6 to 8 months, or at least get you functional so you may not have 100% range of motion, but a whole lot better. All right? If you found the video helpful, you may want to consider giving it a thumbs up, please, subscribing to the channel, and ding, turning on your notifications so you never miss another video. If you have any questions on how to diagnose your frozen shoulder, please leave them down below. And don't forget, at the end of this video, I'll put a link on some basic exercises to help you treat your own frozen shoulder. Good luck.